Hello, welcome to our channel. We would like to say, you will motivate us to make more and better videos about the relationship between nutrients, medication and diseases by subscribing our channel. And, you will contribute to increase the knowledge of others by sharing them. We appreciate you in advance. This video is about a shocking correlation. Autism and vitamin D. Autism Spectrum Disorder, or ASD, is rapidly growing in the world and is dramatically increasing in prevalence. Autism is a common neurodevelopmental disorder characterized by impaired communication and repetitive behaviors. This condition is 4 times more common in males than females. Some common symptoms in autism include abnormal response to sensory stimuli, for example, overreaction to a normal stimulus like a doorbell, but underreaction to a stimulus that usually would hyperstimulate other people. And the others like poor adjustment to social context, deficits in social-emotional reciprocity like being attracted or amused by things that are not usually considered interesting but being bored by things that are usually regarded as amusing. Fixed routines that if they cannot complete or perform, they become pretty irritated and even angry. Fixed interests which may become an obsession or may interfere with the normal functioning of the person. Repetitive behaviors, odd play. Lack of eye contact, not as a confidence issue but as a developmental trait, issues with nonverbal communication, like the lack of gestures. The exact causes of autism are unknown. Multiple genetic and environmental factors have been hypothesized as possible etiologies, for instance. Urban areas than rural areas. Cloudy and rainy areas. Areas that get the least solar UVB. Areas with high air pollution. Birth order and autoimmune disease in the family. Gestational diabetes, preeclampsia, and cesarean section. Considerably, all these situations are related to vitamin D deficiency. In 2008, a researcher named Cannell hypothesized that vitamin D deficiency in pregnant women and children is an important cause of some autism. Autistic children have lower vitamin D levels at 3 months of gestation, birth, and age 8 compared to their unaffected siblings. Vitamin D deficiency during pregnancy and early childhood significantly affects the developing brain, leading to possible adverse neuropsychological outcomes, including autism spectrum disorder. Based on 2 open-label trials, high-dose vitamin D improves the core symptoms of autism in about 75% of autistic children. Why? Incredibly, vitamin D regulates about 3% of the 26,000 genes in the human genome. It is also a neurohormone that plays a role in brain development, cellular proliferation, and differentiation with neuroprotective actions. It also affects neurotransmission and synaptic plasticity. Three possible mechanisms of vitamin D action are suggested to prevent and treat autism. These mechanisms include 1. Anti-inflammatory effects in the brain by reducing the severity of inflammatory cytokines. Because autistic individuals have abnormalities in immune functions like increased inflammatory cytokines similar to vitamin D deficiency. 2. Enhancing DNA repair mechanisms which have anti-autoimmune effects, raises seizure threshold and upregulates glutathione, the master antioxidant. 3. Vitamin D affects serotonin synthesis, a critical nerve hormone, via direct genetic regulation of serotonin synthesis enzymes, both peripheral tryptophan hydroxylase 1 or TPH1 and central tryptophan hydroxylase 2 or TPH2. These enzymes convert an amino acid, tryptophan, to serotonin. Activated vitamin D downregulates peripheral TPH1 while upregulates central TPH2. However, there is a serotonin paradox in autism patients in which peripheral serotonin increases, but central serotonin decreases. Reducing serotonin in the brain and nervous system can cause autism, sleep disorders, abnormal sense of fear, epilepsy, depression, aggression, schizophrenia, and migraine. To prevent vitamin D deficiency, eat vitamin D-rich foods regularly, get enough sunlight or take supplements in consultation with the doctor. It is better to choose oil-based supplements because vitamin D is a fat-soluble vitamin. Noticeably, consulting with a doctor before taking vitamin D is necessary during lactation, pregnancy, and in children, because consuming vitamins and elements more than tolerable upper intake levels is harmful and toxic. According to Food and Nutrition Board, Institute of Medicine, the recommended dietary allowance of vitamin D for adults is 600 IU or 15 micrograms, and the maximum acceptable daily intake is 4,000 IU or 100 micrograms per day. If you like to get one of the best oil-based vitamin D supplements, click on the link in this video's description. Please don't forget to subscribe. Thank you.